Hi, everyone. Our group focused on the U.S. Emergency Department burnout. Kind of our agenda, we will be focusing on the same sections as our report, an overview, the background information of EDs, analysis of what we found, possible solutions to this problem, recommendations that we had, conclusion, and our final
I will be
reflection.
giving an overview of the emergency department sector that will include their importance, current pressures, as well as a historical background. Emergency departments play a central role in the U.S. healthcare system. They are the first point of contact for patients who need urgent, unplanned, or time sensitive care. That makes them the safety net of the entire healthcare system. Right now, overcrowding, staffing shortages, and rising patient acuity are major issues. Clinicians are also facing heavy documentation and administrative demands that slow care and can increase stress. Long wait time and slow boarding of admitted patients make workflow slower and more frustrating. Patient volumes are also unpredictable, and some providers rarely get recovery time between shifts. Historically, emergency departments expanded significantly after World War II as hospital based medicine grew. Today, the ED sector is large and it's growing. It was valued at $158 billion in 2022 and is expected to grow nearly 6% each year through 2030. As part of my overview, I thought it would be as equally important to mention workforce challenges as well as barriers. Operational pressures are directly tied to rising burnout among providers. Even though burnout is lower now than at the height of COVID-19, almost half of physicians still report burnout symptoms. Many doctors still love their work but feel like they can't continue under today's administrative and regulatory burdens. Some of the reasons behind burnout are linked to our system, and we have to acknowledge that many of the drivers are beyond individual providers' control. Things like system failures, resource shortages, and policy requirements increase stress. As I stated, the emergency department is the lifeline of the healthcare system, so strong leadership is essential. Effective leaders must be able to adapt quickly and constantly reprioritize as situations change, because no 2 day ever look the same in the emergency department.
Emergency department burnout is a syndrome caused by chronic workplace stress that isn't properly managed. In the emergency department, this often leads to emotional and physical exhaustion, growing negativity towards the job, and a reduced ability to work effectively. Even though burnout isn't a medical diagnosis, it still has a major impact on the quality of care patients receive. The emergency department is fast paced, unpredictable, and emotionally demanding, which makes staff even more vulnerable. Burnout affects everyone physicians, nurses, support staff, and administrators, and ultimately compromises both staff stability and patient safety. Burnout rates in emergency medicine are among the highest in any medical specialty. Studies show that emergency department physicians and nurses experience high burnout levels due to stress, long hours, and weak organizational support. For nursing specifically, about half of the emergency department nurses report high burnout, and 1 in 4 say they plan to leave the job within a year, according to Icon's research. These numbers show how widespread burnout really is and why it needs more focus. Emergency department staff face extreme psychological and physical strain. Staff reported experiencing fear, emotional stress, and a lack of support throughout the pandemic. Research found that increased PTSD, anxiety, and trauma, especially as clinicians face rapid patient deterioration. Personal protective equipment shortages early in the pandemic also became a major driver of burnout, leaving clinicians feeling unprotected and The emergency department is especially prone to burnout because of its constantly high stress environment. Clinicians must multitask quickly while still providing efficient and accurate care. Overcrowding has become a major issue across the country, increasing workload and intensifying burnout risk. Beyond that, organizational factors such as inadequate staffing, poor teamwork, and weak leadership all play a significant role. These factors reflect deeper system level failures that continue to worsen stress for emergency department professionals. The consequences of emergency department burnout are serious. Burnout can lead to significant mental and physical health issues, including higher levels of PTSD, anxiety, and depression. These effects directly compromise patient care, reducing safety and quality. Burnout also contributes to high nurse turnover, which is one of the most expensive challenges hospitals face. In fact, emergency department turnover costs hospitals millions of dollars each year, according to University of Washington Medicine.
Analysis of emergency departments under strain. We look at the high acuity and rapid swing in patient demand. Persistent staffing gaps, turnover worsens coverage. Documentation and regulatory burden continue to increase, resulting in strain that contributes to burnout and decreased performance. Burnout presents as emotional exhaustion, depersonalization, and moral injury, a lower sense of accomplishment. A recent U.S. study shows that burnout is highest amongst emergency physicians and nurses. A 2023 survey of 46 emergency department providers confirms these elevated levels. Emergency departments must constantly balance cost, experience, and quality. Burnout undermines all three through reduced engagement and empathy, higher turnover, and staffing cost. safety risks, delays, and errors, declining patient experience. Traditional solutions focus on individual resilience. This is insufficient without system redesign. We must reframe burnout as a systems problem, not a personal failure. Redesign around value for patients and caregivers, the core elements of compelling vision for the future emergency department. Authentic leadership that listens and acts. Frontline engagement in decision making. Learning environment that produces psychological safety. Integrated framework links include strategy, structure, culture, and measurement. Driving sustainable improvement, not just short-term
Now we are going to
fixes.
talk about the solution and recommendation. ED operations using value-based workflow. Redesigned workflows, rapid triage, flexible overlap staffing, protected breaks, and interdisciplinary care teams. Simplified workflows reduce burnouts. System supports like competitive compensation, predictable scheduling, and internal flow. The goal is to be sustainable. Next, and we're going to talk about strengthen leadership, culture, and workforce development. Core drivers for ED well-being is leadership, rounding, and listening, sense-making forums, psychological safety practices, participatory decision-making. Culture change requires system elements. Workforce development outcome would be reduced emotional exhaustion and turnover. Data-driven workforce well-being and performance infrastructure. Comprehensive analytics for ED sustainability, integrated dashboards, burnout scores, turnover risk, patient experience, and operational performance. Transparent reporting to reinforce accountability. System-wide supports wellness spaces and rest areas, tuition support, and workflow sustainability programs. Impact rapid improvement cycles and early intervention before burnout escalates.
When we look at burnout in the ED, the key point is that it's not an individual problem. It's a systematic one. The pressures of volume, administrative tasks, boarding, and staffing shortages creates conditions where burnout becomes almost predictable, especially when clinicians also lack autonomy, recognition, and clear communication. The good news is that managers have several levers. We can influence the daily environment, how workflows are designed, and what support systems are in place. Real progress comes from pairing operational fixes with cultural shifts. Things like flexible staffing, rapid triage, better EHR support, protected breaks, and consistent leadership presence. To guide improvement, we need to balance metrics that track burnout, turnover intent, flow, and patient experience, and we need to report them transparently. Ultimately, investing in well-being isn't optional. It's what enables stable teams, better patient care, and a sustainable ED operation.
To reflect and highlight some points we've already gone over, emergency department burnout is a problem across the United States, and healthcare providers who experience burnout directly and negatively impact their patients. However, as has already been observed, we have solutions that may help prevent emergency department burnout, like value-based workflows, organizational culture, and data-driven workforce. There is one other new solution to alleviate emergency department burnout: advanced intelligence. AI can be used to reduce administrative burdens like documentation for patients, ordering labs and imaging, helping place recurring long-term chronic conditions that require prescription orders, and completing discharge summaries. In addition, advanced intelligence may also be used in rapid diagnostics, like chest x-rays, MRIs, and CT scans. Of course, like all things, there are pros and cons to advanced intelligence. For now, AI must be closely monitored for data bias, and that healthcare providers do not become reliant on AI completely. We hope to see more of AI taking on the burdens of emergency department burnout in the future.
Thank you all for your time and attention. We look forward to your questions.